My name is Alexa Eckersall, and today I will be talking about the Bismarck model of Germany. In my presentation, I will be talking about 5 key points. First, I will be identifying and describing the healthcare system model in Germany. Second, I will be talking about the problems or concerns with this healthcare model in Germany. Next, I will be talking about how Germany's public health compares to other countries with the same healthcare system. Finally, I will be talking about cultural differences in Germany and how healthcare workers can respect the cultural diversity of the country. Here's a video of an overview of the Bismarck model.
The mutual insurance model by Otto von Bismarck explained. In 1873, the German Chancellor Otto von Bismarck created the world's first welfare state. He introduced the mutual insurance model, making it mandatory for all. The plan was to head off the upcoming socialists who were organizing themselves with all sorts of workers' health plans. Under the mutual insurance model, every working person contributes part of their income to a central fund. And if someone becomes sick, they're able to claim part of the costs back from this mutual insurance fund. Nowadays, these mutual insurance funds are still used in several countries, such as Austria, Belgium, the Czech Republic, Estonia, France, Germany, Liechtenstein, Luxembourg, the Netherlands, Switzerland, and outer Europe, Israel, and Japan. The funds all work differently, but operate on the same basic principles, where you're free to choose your doctor. You pay for your treatment and then get reimbursed for part of the expenses by your mutual insurance fund. Reimbursement rates can vary between countries, as not every reimbursement system is the same. If you would like to receive full reimbursement for your medical expenses, you may want to take out an additional private health insurance to fill the gap.
Now I will be talking about a general description of the Bismarck model. The Bismarck model was named after Otto von Bismarck, a Prussian chancellor who invented the welfare state as part of the unification of Germany in the 19th century. The insurance system is financed jointly by employers and employees through payroll taxes. These taxes are called sickness funds. In the system, the government does control the pricing. Also, in this model, the doctors and hospitals are mostly private. Overall, this model was built on 3 main principles. These 3 principles are: the government is responsible for universal access to healthcare, health policy is implemented by the smallest political and administrative units in society, and elected government officials negotiate the terms of medical care and reflect interest of different medical professions. The Bismarck model was first instituted in Germany in 1883. Germany was the first country to develop a national system to insure people against medical costs. This system is the Bismarck model. With this model, copays are only about 10 euros per visit. As well as this, hospital stays are similarly low. When it comes to payment, employees' premiums come directly as a percentage of their income. Therefore, low-wage workers pay very low insurance rates. As well as this, there are no network limitations, meaning people can see any doctor that they desire. Also, through this system, there are no deductibles, meaning that you are not responsible for paying a certain amount for health services. The insurance plan will pay from the beginning. Lastly, the insurance card that you get is not only good in Germany, you are also able to use it in many other countries, especially in other countries in Europe. In this study of different countries, the graphs are showing that the Germans were the most likely to be able to get a same-day or next-day appointment and to hear back from a doctor quickly if they had a question. The graphs are also showing that they rarely use emergency rooms, and they can access doctors after hours with ease, which is very important. Here's a video explaining a little more about Germany's healthcare.
Dr. Bloch is a GP in a small town in Germany. She always wanted to run her own surgery, independently and in long-lasting personal bonds with her patients. With her surgery, Dr. Bloch forms a vital part of Germany's self-governed health system. Whereas in many other countries, medical care is organized by the state and its own public institutions, in Germany it is the health system itself that organizes medical care, financed by the fees from all members of the public statutory health insurances. In other countries, surgeries and hospitals are financed by the state with tax money. In difficult times, that can quickly affect quality and quantity of medical care. Also typically German, the principle of benefits in kind, which means members of statutory health insurances are entitled to medical treatment, therapy, cure, remedy, drugs and aids without having to pay for any of it, especially not in advance. Here the state limits itself to setting the legal framework and defining the duties within. The actual medical care is shaped by the care providers and their organizations, for instance, independent ambulatory doctors or hospitals. In the case of independently working doctors and psychotherapists, it is the KBV and its 17 regional associations. They negotiate with the statutory health insurances, the portfolio of treatments and according fees. They also take care of settlement between each surgery and health insurance. And they ensure everyone receives ambulatory care, medical and psychological, even on weekends and bank holidays. Dr. Bloch regularly is on emergency duty. Its nationwide service is available 24/7. Her colleague, an eye doctor with his surgery around the corner, takes part too. Like the psychologist next door, he and Dr. Bloch run their own surgeries, freelance and independently. Together, they form a tightly woven net of around 100,000 surgeries. For patients, this means a great variety of choice and short distances. In the name of these surgeries, the KBV negotiates within the Federal Joint Committee, the highest body in self-governance. Here, all relevant organizations come together. Doctors and psychotherapists from ambulatory care as well as dentists, hospitals, public health insurances and patients. Hence, medical care is decided upon by those who provide it. With their surgeries, Dr. Bloch and her colleagues ensure provisioning hospitals for the treatment of critical and serious conditions. An advantage, not least in times of epidemics or pandemics. In order to maintain this provision, doctors like Dr. Bloch and their psychological colleagues campaign for good political conditions, represented by their regional and federal organizations.
Next, I will be talking about some problems or concerns with the Bismarck model. First, the focus on low costs and efficient care means there are less healthcare services available for citizens living in rural areas. Secondly, a major concern of this model is the question of how to provide care for those who are unable to work or can't afford contributions. For example, aging populations. Lastly, another problem that people bring up is the imbalance between retirees and employees, which can become a big problem when trying to provide adequate health care in a timely manner. Next, I'll be comparing Germany's public health with other countries. First, the life expectancy in Germany is 81 years. The infant mortality rate per 1,000 live births in Germany is 2.555. The physicians per 1,000 citizens in Germany is 4.249, and the health as a percent of GDP in Germany is 11.3%. Compared to France, the life expectancy in France is 82 years. The infant mortality rate per 1,000 live births in France is 2.819. The physicians per 1,000 citizens in France is 3.267, and the health as a percent of GDP in France is 11.5%. Now that we know Germany's statistics for their public health, I will compare it to Japan. The life expectancy in Japan is 84 years. The infant mortality rate per 1,000 live births is 1.8. The physicians per 1,000 citizens in Japan is 2.419, and the health as a percent of GDP in Japan is 10.23%. Lastly, comparing Germany's public health to Belgium's public health, the life expectancy in Belgium is 81 years. The infant mortality rate in Belgium is 2.7. The physicians per 1,000 citizens in Belgium is 3.071, and the health as a percent of GDP in Belgium is 10.59%. Next, I will be talking about cultural differences in Germany. The population in Germany is 91.5% German. Turkish is the second largest ethnic group, being at 2.4%. The remaining 6.1% is made up of primarily Greek, Russian, Italian, Polish, Serbo-Croatian, and Spanish descent. Secondly, there are also many different religions that are practiced in Germany. In Germany, 27.1% of people are Roman Catholic. 24.9% of people are Protestant. 5.2% of people are Muslim. 2% of people are Orthodox. There's also another 1% of people that are other types of Christian. 1% of people are other religions that are not listed, and 38.8% of people do not have a religion that they practice. As well as these differences, another important statistic to know is that 75.7% of the population is urban. Overall, like many other countries, Germany is very diverse, consisting of many different ethnicities, cultures, religions, and values. There are many different people who use the German healthcare system, so it is extremely important to know how to respect all citizens, care for all citizens appropriately based on their background or beliefs, and understand that it is important to understand your differences and want to learn how to make others feel respected and comfortable. Next, I will be talking about respecting cultural diversity. Respecting cultural diversity is very important, not only in everyday life, but also in the healthcare system. One important way to respect cultural diversity is by always asking patients to explain, clarify, or specify details about what they believe. Secondly, another way to respect cultural diversity is to always strive to make patients as comfortable as possible. An example of this would be personal space. Lastly, it is important to try to have prior knowledge and understanding of different cultures in order to make patients feel comfortable and respected. Having prior knowledge of other cultures can also help to avoid miscommunications and possible offensive actions. Thank you for listening to my presentation. These are my sources.